So let's talk about some features of the skull. We'll talk about the orbits, the nasal cavities, the paranasal sinuses, openings in the skull, the female versus the male skull, functions of the skull, cranium, and face. It's only 8 slides, no worries. So, okay, the orbits. The orbits are complex structures. The orbits or eye sockets are formed by 7 bones. The frontal bone forms the superior roof, the sphenoid bone forms the posterior wall, and the maxilla forms most of the inferior floor. So the frontal bone yellow, the sphenoid bone purple, the maxilla orange, and we have a lot of the orbit built. The lacrimal bone anteriorly and the ethmoid bone posteriorly form the medial wall. So here I am, the lacrimal bone and the ethmoid bone. The lacrimal bone is red, the ethmoid bone is green. They're forming the medial wall of the orbit. And then the zygomatic bone, which is blue, is forming the lateral wall. This is the right eye. A tiny little process of the palatine bone is found inferior to the sphenoid bone. So if we look here, what's this little yellow? What's this yellow bone? Sure enough, it's the palatine bone. Spelled wrong, palatine bone. So the palatine bone is found inferior to the sphenoid bone. Okay, now the nasal cavities. Nasal cavities are important. They're often getting infected. It's nice to know a bit about them. The superior roof of the nasal cavity is formed by the frontal bone, the ethmoid bone, and the sphenoid bones. The lateral wall of the nasal cavity is formed by the ethmoid bone, the maxilla, the palatine bone, and the inferior nasal concha. The floor of the nasal cavity is the hard palate, which is formed by the maxilla and the palatine bone. Posteriorly, the nasal cavities, the right and the left nasal cavity, open into the nasopharynx. So that would be what happens here, okay? We have the nasopharynx. Our picture doesn't show it, but there would be the nasopharynx. And naso means nose and pharynx means throat. So, the nasal cavity connects to the nose throat, okay? The topmost part of the throat. The bridge of the nose is formed by the nasal bone. The bony nasal septum is formed by the perpendicular plate of the ethmoid bone and the vomer, and septal cartilage extends anteriorly. I know I'm repeating myself, but repetition is the forge of knowledge. Okay, there are 4 paranasal sinuses in the bones of the cranium and the face, and they are named for the bone that they are in. And they are the frontal, sphenoid, ethmoid, and maxillary sinuses. The frontal sinuses are superior to the nasal cavities, and we see that here. The sphenoid sinuses are posterior to the nasal cavities. The ethmoid sinuses are part of the lateral walls of the nasal cavities. And the maxillary sinuses are lateral to the nasal cavities. They're not shown in the pictures that I have on this slide, but we can see the frontal sinus, the sphenoid sinus, and the ethmoid sinuses in this picture, okay? The maxillary sinuses are seen in this picture. Here they are in the maxillary bones, seen in this anterior view and in this lateral view. All of the paranasal sinuses are air chambers that open into the nasal cavities. They produce mucus that is released into the nasal cavities, ciliated epithelium in the nasal cavities and the sinuses move the mucus towards the throat where it is swallowed. And then any microorganisms that might do us harm are killed in the stomach. The sinuses lighten the skull and make a change in the sound that a person makes when they speak. It makes the sound more resonant and less like a person's holding their nose. And we all did that as kids. I won't demonstrate. Now, openings in the skull. Foramen, fissures, and canals in the skull are passageways for blood vessels and nerves. Three of the openings in the sphenoid bone are the optic canal that the optic nerve goes through, and the superior orbital fissure that the oculomotor nerve, trochlear nerve, ophthalmic nerve, and abducens nerve go through, the inferior orbital fissure that the maxillary nerve goes through. So that's just three of the openings in the sphenoid bone picked out for your enjoyment: the optic canal, the superior orbital fissure, and the inferior orbital fissure. But there are many, many other openings in the skull. You will not learn them. You will only learn the optic canal and the superior orbital fissure, okay, and the foramen magnum. But that's a huge, obvious one, so that's a lot of learning off your back. If you take another anatomy course, they can teach you more of the openings in the skull. They're nice to know. It's how arteries and veins get in and out of the skull, how nerves get out of the skull. So they're important, but too much. Now, a bit on the female versus the male skull. They are often different in general, although individual variation is common. The female skull has the following: a frontal bone with a less prominent brow ridge, that's shown with the red arrow, a shallow or nasal radix, which is kind of like the indent below the brow ridge, shown with green arrow, a mandible with a less prominent chin, shown with the yellow arrow, a mandible with a shorter ramus, shown with the blue arrow, and then a mandible with a less square angle than the male skull, shown with the purple arrow. The only thing is that in this skull, in these two skulls, the female skull actually has a more square angle than the male skull. This is just an individual variation. This female skull just happened to have a squarer angle, and this male skull just happened to have a less square angle. Okay. And in general, what are the functions of the skull, the cranium, and the face? The cranium completely surrounds and protects the brain. The skull contains the nasal cavities, the paranasal sinuses, and the oral cavity. The skull is the site of most of our sensory organs. The nose for smell, the eyes for vision, the ears for hearing and balance, and the tongue for taste are all in the skull. In that way, we are very skull-heavy organisms. The mandible and the maxilla hold our teeth. So there's a heck of a lot going on in the skull. The hyoid bone. The hyoid bone is inferior to the mandible and superior to the thyroid cartilage. It is the only bone that does not articulate with any other bone. It is attached to the styloid process of the temporal bone by muscle. It is very mobile. It is an attachment point for muscles that move the tongues and the larynx. So let's look at this picture. The hyoid bone is a horseshoe-shaped bone. It is inferior to the mandible. We didn't learn thyroid cartilage yet, but there's that thyroid cartilage, and the hyoid bone is superior to it. And we see that it's attached to the styloid process, okay, here in this picture, okay, by muscle. So there is no joint between the hyoid bone and any other bone. Now you can take your own hyoid bone and find it between your mandible and your thyroid cartilage. I'm holding mine right now. And you can prove to yourself it's very mobile. You can push it all the way to the right and the left because it's really only on two slings of muscle. Okay? You can push it back and forth. So that's the hyoid bone.